Hello, this is Brian Casey from the Imaging Wire. We are here at ECR 2026, the annual meeting of the European Society of Radiology, and we have with us right now Dr. Gennaro D'Anna. He is an Italian radiologist, a neuroradiologist, and a self-described AI enthusiast. Dr. D'Anna, thanks for being with us today.
Thank you so much, Brian, for giving me the possibility to talk with you. I am a neuroradiologist. I have been a neuroradiologist clinical in public hospital for several years. Now I am in the private practice in Milan, and over my activity of clinical neuroradiologist, devoted especially to the collaboration and the talk with patients, I also developed a great enthusiast on artificial intelligence, also because this is no more a revolution. Now in these days we can see that AI is around us, and I think that is so useful to take AI wisely, but with the right enthusiasm.
Yeah, perfect. Now, you just came out of a panel discussion, where you talked about how radiologists can improve their communication skills. So do you feel like radiologists need improvement? And if so, what are some of the ways they can go about doing that?
Yeah, communication is everything. It was in the last century, over the centuries, and in these years is even more important, because a lot of people can have a vast audience. A lot of people can drive not the right concepts, and we as physicians, for patients and for the other medical specialties, we need to communicate better. I will try to do. I continue to learn. It's also coming here is also useful because we can discuss with other colleagues, like doing the last session, and also it's important to maintain professionalism, because professionalism is what distinguishes us from the general audience, and the general audience want a physician, because a neuroradiologist is first of all a physician, want a neuroradiologist that be professional, want a figure that is relevant and is clear.
Yeah. Now, one of the things that we're seeing in the US is patients are getting closer access or better access to their own data, and these are things like radiology reports and communications from the radiologists that aren't really written for patients, right? And so it's causing a lot of confusion, and some people are turning to large language models, to AI large language models, to maybe take a radiology report and kind of write a version for patients. Is that something that's happening here in Europe as well?
Oh yeah, definitely. A lot of patients told me, oh well, I asked ChatGPT regarding it, like in last years. Oh well, I googled about it, but large language models that are powerful are made to please the people, the user,
Yeah.
not to explain criticisms, and it's important, and it's also, even with the use and the development of large language model, it's important for us to be present in the journey of a patient, in the life of a patient, because our professionalism is not a choice, and for patient make a difference, even with powerful applications like large language models.
That's a great point. So what else are you doing here at ECR Week, and what else are you looking forward to participating in?
Well, I look forward for tomorrow regarding the competition of the young colleague squads, where I will co-chair, and it's important that also young people will be trained and will start to be on stage, to be more confident with a large audience. So having a more trained and more experienced chair allow the young colleague to be more relaxed during the sessions, and also is wonderful to meet a lot of people from other countries, because radiology is unite, and especially in these times, it's so important to send a unity message.
Yeah. Well said. Well, Dr. Gennaro D'Anna, thank you so much for being with us. It's a pleasure.
It was my pleasure. Thank you, Brian.
All right. Signing off for the Imaging War, my name is Brian Casey.